Lansing, Michigan. Michigan is updating its COVID-19 quarantine guidance in accordance with recent recommendations from the Centers for Disease Control and Prevention. The Michigan Department of Health and Human Services, DHHS, made the announcement on Friday, December 31st. The CDC is recommending a shortening of quarantine and isolation for those infected with COVID. The recommended period is now 5 days instead of 10, as long as an individual is asymptomatic and symptoms have improved, followed by an additional 5 days of wearing a mask when around others. The guidance includes those who are not vaccinated or boosted. CDC officials said the guidance is in keeping with growing evidence that people with the coronavirus are most infectious in the 2 days before and 3 days after symptoms develop. The updated guidance is specific to the public and does not change the current guidance recommendations for congregate settings, early childcare or K-12 settings. These settings should continue to use existing guidelines and policies regarding quarantine and isolation, DHHS stated. Guidance will continue to evolve as more information is learned from CDC. We have safe and effective tools for preventing the spread of COVID-19, Dr. Natasha Bagdasarian, DHHS Chief Medical Executive, said in a release. Getting vaccinated continues to be the best protection against severe illness and hospitalization, and we urge all Michiganders over age 5 to get vaccinated as soon as possible. These most recent updates to the quarantine and isolation guidelines are a reflection on our progress as we learn more about COVID, but we are not in the clear as variants like Omicron continue to create new challenges in the fight to end this pandemic. Continue to wear well-fitting masks over your nose and mouth, test and social distance to prevent the spread of COVID-19, avoid large gatherings and get vaccinated and boosted if you haven't already. Earlier in the week, DHHS stated it was retaining longer quarantine and isolation times despite the CDC's recommended reduction in them. At that time, state health authorities said they intended to review supporting evidence while awaiting additional information from the CDC. DHHS officials did not state what information prompted their changed stance on quarantine durations, and a spokesperson for the department could not be reached Friday morning. Michigan data shows those who are unvaccinated have 4.3 times the risk of testing positive for COVID-19 and 12.2 times risk of dying from the virus, compared to people who are fully vaccinated. The specifics of the new COVID-19 isolation and quarantine guidance will be shared as further information becomes available from the CDC. Last week, DHHS adopted updated CDC guidance on isolation and quarantine for healthcare workers. For more information, visit michigan.gov/coronavirus. To find a vaccine location near you, visit vaccinefinder.org. Read more. Michigan retaining longer quarantine, isolation guidelines despite CDC modifications in face of Omicron. COVID Q&A, when will vaccines be available for younger kids? Is Omicron in my county yet? New COVID-19 cases in U.S. soar to highest levels on record.